Ciloxan drops are used to treat eye infections caused by bacteria. The active ingredient, ciprofloxacin, is an antibiotic that stops the growth of bacteria. It's important to note that this medication only works for bacterial eye infections and will not be effective for other types of eye infections. Using antibiotics unnecessarily or excessively can reduce their effectiveness. It's important to follow the dosage instructions provided by your healthcare provider. When using Ciloxan drops, it's important to wash your hands before applying the medication to avoid contamination. Do not wear contact lenses while using this medicine, and make sure to sterilize contact lenses according to the manufacturer's directions. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place one drop into it. Look downward and gently close your eyes for 1 to 2 minutes, then apply gentle pressure at the corner of your eye to prevent the medication from draining out. Avoid blinking or rubbing your eye. If using another eye medication, wait at least 5 minutes before applying it after using Ciloxan drops. Use this medication regularly and for the full time prescribed, even if symptoms disappear. Be sure to inform your doctor if your condition persists or worsens. When using Ciloxan drops, you may experience some temporary stinging or burning in your eyes, as well as discomfort, itching, redness, tearing, blurred vision, or sensitivity to light. This is normal and should improve with continued use. If you notice any new or worsening eye symptoms, such as increased discharge or eye pain, be sure to contact your doctor right away. It's important to keep your scheduled appointments so your doctor can closely monitor your eye infection. If you experience any serious side effects, such as staining of the eyes, swelling, or worsening vision, be sure to inform your doctor immediately. While a serious allergic reaction to this medication is rare, it's essential to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. Remember that the use of this medication for prolonged periods may result in a new fungal eye infection, so be sure to use it only as prescribed. If you notice any new or worsening symptoms, contact your doctor promptly. As always, if you notice any side effects not listed here, contact your doctor or pharmacist for further guidance. And if you have any concerns or questions, don't hesitate to reach out to your healthcare provider for more information. Before using Ciloxan drops, make sure to inform your doctor or pharmacist if you are allergic to ciprofloxacin or other quinolones, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you use contact lenses or have other eye problems. After applying the drops, your vision may become temporarily blurred or unstable. Avoid driving, using machinery, or doing activities that require clear vision until your vision has cleared. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to follow your doctor's instructions and use the drops at the recommended times for the best results. When using Ciloxan drops, it's important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help ensure the safe and effective use of Ciloxan drops. Remember to always follow your healthcare provider's instructions for the best results. If this medication is swallowed, it could be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. If you reside in Canada, you can call a provincial poison control center for assistance. Remember, it's important to store this medication safely out of reach of children to prevent accidental ingestion. Do not share this medication with others. This medication has been prescribed for your current condition only. Throw away the unused medication after treatment is completed. Do not use it later for another infection unless your doctor tells you to. If you forget to use a dose of Ciloxan drops, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one and use the next dose at your regular time. Don't take a double dose to make up for the missed one. When using Ciloxan drops, it is important to store them at room temperature and away from light. Do not freeze the medication. If the solution changes color, becomes cloudy, or develops particles, it should be discarded. It is essential to keep all medications out of reach of children and pets. Additionally, it is important to properly dispose of this product and it is expired or no longer needed. This should be done in accordance with the guidance of a pharmacist or local waste disposal company. Avoid flushing medications down the toilet or pouring them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.